This analysis examines the early antifungal activity of Rezafungin, focusing on its potential to reduce treatment duration for Candidemia and invasive Candidiasis. Data from the Strive and Restore trials are pooled to assess the efficacy of a single dose as a treatment stepping stone. Candidemia and invasive Candidiasis present a clinical challenge due to high mortality rates, especially in intensive care unit and immunocompromised patients. The economic burden is significant, with high healthcare costs and resource use from prolonged therapy. Current guidelines recommend at least 2 weeks of echinocandin therapy post-blood culture clearance. Rezafungin, a next-generation echinocandin, is approved for Candidemia and invasive Candidiasis in adults, including in the United States. It offers once-weekly dosing due to its distinct pharmacokinetic profile, with a 400 mg front-loaded exposure on day 1. Phase 2 and 3 trials, Strive and Restore, confirmed its efficacy and non-inferiority to Caspofungin. The Strive and Restore trials were multi-center, randomized, double-blind, and controlled. They compared weekly Rezafungin dosing with daily Caspofungin. The pooled analysis included 294 patients with confirmed Candida infections, evaluating efficacy and safety at days 7, 14, and 30. This robust design supports comprehensive data analysis. The baseline characteristics of patients in the Rezafungin and Caspofungin groups were well matched. Median ages were similar, with most patients having acute physiology and chronic health evaluation 2 scores under 20. Candidemia was the primary diagnosis for the majority. Renal function and catheter placement rates were comparable, ensuring valid efficacy comparisons between the groups. Rezafungin maintained non-inferiority to Caspofungin in all-cause mortality at days 7, 14, and 30. At day 7, the difference was plus 3% within the 20% margin. By day 30, the difference converged to negative 1.5%, indicating the groups were essentially equivalent. Mycological eradication rates at day 7 were 71.2% for Rezafungin and 65.2% for Caspofungin, with a non-significant difference of 6.6%. Eradication rates remained similar at days 14 and 30. Notably, Rezafungin showed higher rates in intensive care unit and Candida glabrata subgroups at day 7. Rezafungin shows a median time to negative blood culture of 22.3 hours, significantly faster than Caspofungin's 26.3 hours. At day 7, 86.2% of Rezafungin patients had negative cultures, compared to 73.8% for Caspofungin, indicating a clinically meaningful early advantage with a single 400 mg dose. Exploratory analyses show Rezafungin consistently favors early endpoints across key subgroups. However, small sample sizes in intensive care unit and Candida glabrata subgroups limit definitive conclusions. Candida glabrata is prone to drug-resistant mutations, but Rezafungin's high front-loaded exposure may suppress resistance, ensuring high target attainment probability after a single 400 mg dose. Patients with an Apache 2 score of 20 or higher experience significantly higher all-cause mortality. Mycological eradication rates were lower in these high-severity patients, though not significantly different. Time to negative blood culture was similar across Apache 2 scores, indicating Rezafungin's pharmacological activity remains effective even in more severe cases. Day 7 safety data shows reassuring consistency between Rezafungin and Caspofungin. Overall treatment-emergent adverse events were similar, with no unexpected signals. Severe treatment-emergent adverse events were nearly equivalent. Common events included hypokalemia, diarrhea, and anemia, aligning with the echinocandin class profile. Drug-related serious adverse events were minimal, with no deaths reported in either group. Rezafungin demonstrated non-inferiority to Caspofungin for all-cause mortality by day 7. It showed faster blood culture clearance, suggesting a promising pharmacokinetic profile. Subgroup analyses indicate potential benefits for Candidemia, C. glabrata, and intensive care unit patients. The upcoming SCAT trial will further explore antifungal therapy durations for uncomplicated Candidemia.